Mask mandates are going into effect in Minneapolis and St. Paul. Me personally think they never should have left because look at the mess we're in. I have COVID. I know Dr. Greg Poland probably has heard that already. The husband's in the bed. I'm pretty sure I gave it to him. Kind of a mess. So Dr. Gregory Poland from the Mayo Clinic is joining us now to talk about the very latest on vaccines for the little ones and answer all of our other questions. Dr. Poland, welcome back to the program.
Thanks, Jordana. Happy New Year, and sorry to hear that you got this, but because you're immunized and boosted, this will be a relatively mild, maybe even trivial illness compared to somebody who's not been immunized.
Agreed. And I think despite my immunocompromised state, despite that, it has not been so bad. And, my husband just feels like he has a cold. And
Sure.
and the other people in our family, I'm sure we were all exposed to the same thing. They're, immunized and boosted, and they are not sick. So thank God.
And this is the key thing, because people misunderstand this. No vaccine is 100% perfect, but what getting vaccinated and boosted does is convert an illness that causes moderate to severe illness, hospitalization, and unfortunately sometimes death, converts that into an asymptomatic, mild, or trivial illness. That's the importance and the impact of the vaccine.
Yes. Yeah, we're seeing that now. Doc, let me ask you this. I spoke with Dr. Williams, who is your colleague at the Mayo Clinic. I know you probably don't know each other. He's my hematologist this morning. And he said to me, all right, Jor, let's monitor your symptoms, because he was following some research that said, day 1 through 4 from diagnosis, from positive test, the symptoms can be bad. He said he's also seeing a resurgence of symptoms around day 8. Is this what you're hearing? Because this was the first time I heard of this.
No, that would not be typical. But remember that for Dr. Williams, his practice is people who are immunocompromised. And that may well be a feature that we see in people whose immune system wouldn't be working as vigorously.
Dr. Poland.
Okay, good to know. Mm-hmm.
It's good to have you back on the air, Dr. Poland. Thanks for joining us today.
You bet.
I just noticed Italy is banning unvaccinated people over the age of 50 from going to work starting on February the 15th. Different countries obviously doing it differently. Really? Some in Europe far more aggressive than what we're seeing here in the United States. I'm just curious, Governor Walz earlier this week said the Omicron wave is expected to peak by the third week of January, and he cited modeling from the Mayo Clinic. Based on everything you're seeing, is that a reasonable prediction in your estimation?
I think it's one of many possibilities, but the most likely of those possibilities. But the threats that we face are not only Omicron. As you may or may not be aware, there's a new French variant that has been identified, and 60 separate times a new Omicron variant identified in New York City. So those remain possibilities. And the other thing we're starting to see is a rise in influenza cases, which of course overlap in symptoms so closely with coronavirus that alone causes another surge effect on the medical system. So we've got quite a mess, don't we?
Yeah,
absolutely. Hey, Doc, talk to us about these employees at the Mayo Clinic, because this is in the news today, and I certainly don't mean to put you on the spot about your colleagues, but about 1% of folks at the Mayo Clinic, I guess, refused to get a vaccine. So the employees were let go. Do you have any idea where these employees worked? I mean, are we talking about doctors and nurses? Are we talking about support staff? And what's the reasoning here?
That's a great question. I really don't know the answers to those. I'm not involved on that side of it. What I can say is that for an institution like Mayo Clinic or any other healthcare center, number one priority has got to be the safety of our patients. Jordana, you've talked about, your own healthcare journey. It is imperative that we create as safe an environment as possible for you and any other patient that would come to Mayo Clinic by preventing with safe and effective vaccines the possibility of transmitting that virus to a susceptible patient. And I think that's a goal widely shared among medical centers. I also think that an issue we have nationally is people using a variety of reasons as to why they shouldn't get vaccine. And when you really dissect many, not all, but many of them, it's based on fear and misunderstanding. Sometimes political ideology or religious ideology that really doesn't stand the test of close discernment.
Dr. Poland, I'm curious. Just today somebody said, hey, we all have to get on with our lives. We're going to have to live with this thing. And I agree. I'm vaxxed. I'm boosted. I'm going to catch this thing like most everybody else, and hopefully symptoms will be mild. My oldest son and his wife have been traumatized. I think many young parents with very young children who can't get a vaccine yet are living in fear. And they've made it clear to me, hey, if you want to see your grandson, you play by our rules. And, you know, we need full disclosure. You need to tell us where you've been. And I get that. So we're playing by their rules. We want to keep seeing our soon-to-be 2-year-old grandson, Jordan. What advice would you have for parents with younger kids who have not been able to get the vaccine? Is this being hyped out of proportion? Are small children, infants, babies, toddlers really getting sick from this thing?
It's a great question, Paul, and I'm vitally interested with a 4-month-old grandson, our first grandchild. So, you know, in many ways, this is personal. I care a lot about the answer to this question. And let me try to quickly explain it. So it is true that in young, otherwise healthy children, and remember, everybody age 5 and older right now can get a vaccine. And I'm hoping no later than mid-ish 2022 or sooner, children 6 months to 4 years old will be able to get a vaccine. But the issue stands that at least with Omicron, that can change with other variants. With Omicron, the illness is almost always mild in children.
Okay.
But here's the rub. In the youngest children, Omicron is an upper airway disease primarily, whereas Delta was more lung-based. Why are we seeing such a surge in hospitalizations among young children and babies? Because their upper airways are so small that they end up running into medical complications and problems and have to be hospitalized. So you look at Texas Children's Hospital, the largest pediatric hospital in the U.S., they have had a 4-fold increase in the number of COVID-related hospitalizations. New York City, 5-fold. Chicago, 4-fold. Now, those sound like impressive numbers, and they are. But if you're looking just at probability, a young, otherwise healthy child is likely to have the equivalent of what we would have called a cold.
Okay. That's reassuring.
Okay. And tell me again, Doc, because we were hoping that these vaccines for under 5 would be very soon. Are we not? And also the kids for 12 to 16. Are their boosters not available? I thought they were going to be available this week for these kids.
They are. In fact, what happened is that FDA approved on, was it Monday, I think, booster doses with Pfizer for the 12 to 15-year-olds. In fact, even reduced the interval to 5 months after the second dose. They approved a third dose in 5 to 11-year-olds who are moderately to severely immunocompromised. So the issue has been those below the age of 5. And what happened there very quickly is that the trial was done not with the 30 microgram dose that adults get, not with the 10 microgram dose that younger children get, but with 3 micrograms. And it didn't prove to have the same level of immunogenicity. So they're going to have to redo that study either with a third dose or an increase in dose.
Doc, I know we're running out of time, but I'm going to try to squeeze in one more question because it's really been on my mind. When it comes to testing in this country, it feels like it's every man, woman, and child for themselves. If you can find an antigen test, which may or may not be reliable, the PCR tests are much more reliable, but they can be expensive. You don't get instant gratification. I realize the FDA has to approve all of this. We don't want fly-by-night shysters, having tests flooding the market that aren't accurate, that give people false hope or false positives or negatives. But are you content with where we are as a nation 2 years into this when it comes to testing?
Absolutely not. We need to have the ability, and I think the administration is working hard on this. I don't know all the factors surrounding the delays, but they're working hard on home tests. You're exactly right, Paul, that some of the rapid antigen tests don't have high sensitivity with Omicron. Best resource for determining that is the FDA website that almost daily updates. I noticed just yesterday that they had added 3 over-the-counter tests that did not perform well. So we need to have that kind of testing. As you point out, PCR is even more difficult. It takes more time. And we've got this huge demand that I don't think anybody really accurately predicted when you go back in time to look at this.
Okay.
I wish we had more time, Dr. Poland. It's always great to talk with you. Thank you for answering all of our questions and the great work that you do, sir.
Yeah, thank you, Doc.
Thank you.
And congratulations on that new grandson.
Oh, it's wonderful, as you know.
Yes, it is as good as
Mazel
everybody
tov.
said it
Yes.
would be. Thank you, Doc.
Be
all right,
well.
be safe.